Hit that. Hey, everybody. I'll say hello while Lisa gets us on Facebook.
All right.
I'm Jodi Franklin, super excited to be here. If you all want to say hello in the chat thread, you can, and just let me know where you're from and why you may be interested in functional medicine. And if you have questions, you can use the Q&A tab, and I'm happy to answer them. As we go throughout, Lisa can kind of read them off to me. I think she's getting us on Facebook now. So just let us know when we're in, Lisa.
We are in Acupuncture Business Academy right now.
Excellent.
So welcome, everyone. I have invited Jodi Franklin into this group. So I'm super excited. I did not know that functional medicine was such a hot topic for acupuncturists. So I know it is among my patients because they're always asking me questions and wanting to find functional medicine practitioners. Welcome, Jodi. I am thrilled to have you here. I really appreciate you taking time to do this. And I'm just going to go ahead and hand this over to you. We will watch the chat in Facebook. We'll watch the chat on Zoom. So if you have questions, please put them in there. And Jodi is here to help us understand how we can incorporate this in our practice, increase our revenue, get better patient outcomes. So take it away, Jodi.
Yeah, I actually wanted to say that a lot of acupuncturists are getting into functional medicine. It is a natural progression and add-on to your repertoire, your toolbox. And I know you all work with so many people who have chronic pain, fibromyalgia, migraines, digestive issues. These are all things that can be corrected with functional medicine. All kinds of even hormonal issues like menstrual cramps. These are things that can be reversed. And I've done it hundreds of times in my practice. And I want to thank you, first of all, Lisa, for having me on. And you guys, you all know how lucky you are to have Lisa put this group together. She is so amazing. And I have gotten to know her a little bit over the past year. And she's just a lovely, lovely lady and really looking out for you all. So thank you for having me.
Thank you. I'm going to interrupt you for 1 second. I see that the chat is disabled in Zoom, so I'm going to be playing around with the tech to try to open that up for everybody. So I apologize for interrupting you, and I'm sorry, everyone on Zoom. I will try to get that open for you.
Okay. Yeah, no worries. So I actually got into functional medicine late in life. When I turned 50, I had a bit of a midlife crisis. So what do I really want to do with my life? And what got me interested in it is when I was about 25 years old, I wound up with an autoimmune disease. I actually wound up with chronic urticaria. I had hives all over my body, and I was a mess. Every night, waking up in the middle of the night, covered with hives, scratching myself till I bled. And I went to some lovely, wonderful practitioners who would diagnose and then prescribe medications. And I tried probably about a dozen medications. I shouldn't say dozens, but about a dozen different medications. And nothing seemed to work well except prednisone. And obviously going on prednisone long-term is a big problem, especially now in the wake of COVID, but you set yourself up for cancer. And I have a very huge, long history of cancer in my family. So I was very concerned about that. And then when I would taper off the prednisone, I would have a rebound reaction that was 10 times worse. So it wasn't worth it to me. I suffered mightily. And what happened is when I was in my late 30s, I gained a few pounds, and as many of us do. And I started cleaning up my diet a little bit and noticed that my hives didn't bother me as much. And that sort of set me off on this journey to learn what else can I do to make it so I don't have hives anymore. And I made it so I was almost symptom-free by the time I reached this functional medicine journey. And then I went back to school first for nutrition and then functional medicine. And my nutrition background, it's like a health coaching nutrition school, and it really didn't give me much information that I didn't already know. And I sort of felt it was a bit of a waste of money, but it led me to this functional medicine piece. And once I saw the school I was lucky enough to go to, it changed my life. And within the first semester of going to the school, which I can tell you more about, and I can tell you about other school options as well, but going to this school, I actually built almost a full practice by the time I finished my first semester there, just word of mouth. And what I did is I offered half-price sessions and let people know what I was doing and gave them examples of what if you have a headache, come to me, that kind of thing. And it's only going to be half price while I'm in school. And before I knew it, I quit my part-time job and I had a full full practice and now eventually a waiting list to work with me. It was incredible. And I kept raising my rates, which was great. I started out lower and then worked up, and now it's a huge lucrative career for me. And I offer a sliding scale for some people that I want to work with that can't afford my services, and that's okay too. But what I was going to say for you all is, because you are acupuncturists, you already have a patient base that's huge. And what you can do is say, Mary, you've been coming to me for years. You still have this arthritis pain. Why don't we sit down and look at your lab work? And I'm doing this functional analysis at half price right now. So you can come to me, we'll sit down, go through your lab work, go through your symptoms, and I'd like to suggest some things that are going to get you massive relief. How does that sound? And then all of a sudden Mary's like, oh yeah, I'll do that. Or even, offer it for some kind of special rate for a lab review and recommendations. And you will be shocked at how many people you'll get jumping onto that. And the school that I went to actually encourages you to start using it in your practice right away. So as you learn functional medicine, you're using it. So even as you're, performing the acupuncture, you can talk to them about, gee, I think you may benefit from X, Y, and Z as you're going. So more people will start coming to you because they'll be amazed at your knowledge base and how much more you've helped them. So even if you don't do it as a private consultations and go to that next step, it's going to help you get better results for the patients that do come to you. And you'll have people coming from all over, like even farther and farther away. And that's what happened to me, is people started coming to me from farther and farther away. And eventually I did it all on the phone, and eventually Zoom came about and I started doing consultations on Zoom. And by the time the pandemic hit, I was already 90% virtual anyway, because I was working with people all over the world, helping them reverse chronic diseases. So it's been the most rewarding thing I've ever done. Is there a question, Lisa?
Yeah, sorry to interrupt you. Two things. One is just for people who have questions, just use the Q&A instead of the chat. So that'll work. And one of the questions is, how do we know what blood testing is covered by patient's insurance? If we order a test, will they be charged full price?
That's a great, yeah, go ahead.
You segue into your recommendation to say to people, I'm just starting out. Can you do this for just a limited price? How are you pricing in your consultation fee versus the fee for the blood work or the testing?
Yeah, that's a great question. So I have a couple packages. One includes all the lab work and one doesn't. So they can choose what they want to do. And sometimes I'll just recommend, you don't need to do all this lab work because you already have a bunch, or we're only dealing with migraine pain, which is kind of an easier fix than like an entrenched someone who has 3 autoimmune diseases. And, so someone like that might benefit more from a lab work included kind of scenario. Now, if you are in a state that you can't order lab work, I know it varies for acupuncturists. You can actually get an account with there's a couple lab distributors that you can get an account with. I actually have a discount link for $250 off one of them, which I can give to you, Lisa, you can hand out. But the other thing is, once you graduate SAFM, you'll have the ability to order lab work, facilitate getting lab work for your clients or patients, no matter what, because you can get an account with this company, and then a doctor will sign off on it. So you put in the lab work and the doctor signs off on it. Now, the nice thing about it is it's actually cheaper than insurance in most cases. So insurance will charge a fortune for lab work, and then they have to pay a pretty hefty copay for it in a lot of cases. Whereas I can get a full thyroid panel, a CBC, CMP, vitamin D, like a whole bunch of things for like $120. I mean, it's just ridiculous. So yeah. So I can give you my resources for that, but yeah, I mean, it's not hard to get lab work. And then functional lab work is a different story, and it's usually not covered by insurance anyway. So I do things like GI maps, stool tests, and organic acids tests, things like that. But I just pass the savings on to my clients because I get, wholesale pricing on it. I don't upcharge it. A lot of people do upcharge. It's up to you. Like I used to upcharge the Dutch test because it would take me longer. That's a hormone test, a dried hormone urine test, and it used to take me longer to interpret those, so I would upcharge it by $100. But you can decide what you want to do with that. It's really, there's lots of ways to do it. Any other questions, or should I?
There is another question here. What's the best way to let a patient know how many follow-ups or how frequent they should meet with you?
So everybody does this differently. And some people do it in a managed care setting where you have 15 minutes and then you can make appointments with your patient more frequently to do that. For me, I find that meeting every 2 to 3 weeks really works out well. So I usually try to do a twice a month program because it gives them enough time to make the changes, maybe get some lab work done. And then after that, you can meet with them again, and then you'll see the progressions and then move on to the next. So it really depends on how you want to do it. Some people do every week, some people do once a month, some people do it in more managed care settings. So if you're meeting with your patient, let's say twice a month, you might want to do it there are a couple times a week, maybe do it once a week with them, meet with them for one of those sessions a week. So it really depends. I'd like to show you some of my success stories if I could share the screen, just to encourage you all and just show you what is possible with this. I can't even believe the success I've had with this. Honestly, diseases that were previously thought to be incurable are completely curable. And we do this all the time in my business. But this guy, you could see on the top left, this is his thumb. He had psoriatic arthritis. This is a guy, actually, I'll stop the share and show you, but I wanted to show you his thumb there. I'll show you on my actual website what I have here, but this is John. And he suffered with severe psoriatic arthritis where he was in such pain he couldn't tie his shoes. He was on prednisone all the time, and he was just a mess. He couldn't enjoy the woodworking he loved to do. Within 5 months, we were able to completely reverse it. He weaned off the prednisone and his psoriasis was gone. He has been in remission since. You can see on the right how much in remission he is. And as a side effect, he lost 30 pounds working with me, which was great. He's pain-free for the first time in 2 years. And he's doing fantastic. And he just, he's told about half a dozen people who live in his area. He's in Idaho, and I have all these clients in Idaho now, which I'm in Boston. So that happens. You'll get referral after referral from people who are happy. This is Beth. She came to me riddled with such fibromyalgia and migraine pain that she was in bed by noon every day on Vicodin, every day Vicodin. So she couldn't be a parent to her children. And I worked with her for about a year, but within just a few weeks, her migraines were gone. So that really helped her so she could get out of bed. And she weaned off the Vicodin. She's no longer on that medication. She's weaned off her antihistamine. She no longer has chronic urticaria. That's what I had. And I'm super happy to say I'm in full remission as well. But and then, GI issues, insomnia, everything's gone. She lost 90 pounds as well.
She looks like a different person.
Doesn't she look amazing?
Yeah,
she is a bundle of energy now. She is a completely different person, and she's referred her husband, her brother-in-law, a whole bunch of people to me as well. So they're your best advertisements.
I want you to keep going, Jodi, but I just want you to know there are several questions that are coming up about where did you get the functional medicine certificate? Is there a school or program you recommend? What's the best school for functional medicine? Can you briefly talk about curriculum? Are there fee schedules? So I just want you to know that's coming up.
Yeah, I will definitely get into that.
I know we're going to cover that. So
yeah, I definitely will. I'll just show you a couple more just for inspiration. This is arthritis. She had really bad arthritis and gut issues. He had type 2 diabetes, gout pain, and hypertension. And they are just like in remission for everything. The diabetes was gone within 3 months. Just amazing. And I could go on and on. I work with acid reflux. I work with ADHD. This is asthma. This is anxiety. This woman couldn't even go. She was ready to drop out of college because she couldn't go to the classes. She couldn't sleep in her dorm room because of her daily panic attacks. And now they're all gone. Her mother actually, there's another client whose mother asked me for a stack of business cards because her daughter's anxiety and depression are gone now. But I could go on and on, but you get the idea of what is possible. You're welcome to visit my website, JodiFranklin.com, and check out, or FlorianFranklin.com and check that out.
And you specialize in vitiligo too. I noticed those last pictures there. Is that right?
Yes.
You have
in
a program?
fact, yes. Thank you for asking about that. I work with vitiligo. I remember I had a client come to me when I was in my first semester of training at the program I went through, which I'm going to talk about in a minute. But and she had vitiligo, and I had never heard of anybody going into remission for it. But I said, you know what? My teacher's got 3 degrees from MIT. I have the resources of the school to back me up. I'm confident I can help you. I'm hoping we could stop the progression of the disease. And she had it since she was 8, and she was in her late 30s at this point. And within just maybe 6-7 months, she started getting major pigment back on her skin. And she called me, she couldn't even talk. She was crying so hard. She says, I can't believe it. It's like, it chokes me up just to talk about it. But she said, I want you to post my success on your page, on your Facebook page. And I did. I had people all over the world reaching out to me with vitiligo. And all of a sudden I'm this world authority on vitiligo. And since then, I've worked with a couple hundred people who have had vitiligo and put them into remission, stopped the progression of their disease. And we have a group program now called Vanishing Vitiligo. I partnered with one of my graduates of the school that I went to. She also had vitiligo. She's in full remission now. And we have people coming in from all over the world joining this program. And it's fantastic. So I love that.
Wow, that's great.
Yeah. So that's a great way to leverage and bring in more people and help more people with this, because you'll find that you get filled up pretty quickly, and offering it to groups is just a great way to do. And I know Lisa and I are a big fan of groups.
That's how we met.
But
group program, right?
I know there was a question about the school I went to, and the school I went to is called the School of Applied Functional Medicine. And actually the timing on this talk is really good, because they open twice a year. And the September cohort is starting next month, right? So they're offering $1,000 off between now and August 10th. So if any of you are interested, do it before August 10th, because you'll get the discount and you can start learning this stuff. Now, I'll show you the pricing and everything in a minute, and I'll explain about other schools in comparison. But I will say that I built, even when I started using it, I paid for my schooling within the first semester, and the nutrition health coach school that I went to before. I made enough money to pay for both just in the first semester. So the return on investment was huge. And I can't recommend it highly enough. I cannot believe what I'm charging now. Honestly, I hate to even say that, because it sounds like that's not why I got into this, but supply and demand. People know I'm competent in what I do. They come to me and I charge a good fee for it. And I make a very good living doing this now, which has enabled me to put 2 kids through college. So it's been amazing. But anyway, so it's School of Applied Functional Medicine. I'll show you. I have some old slides here that I used to be on the leadership team for the school. And I'm a teaching consultant for them now. So people can book a one-on-one with me to get help with a patient or client case they're working on.
And thank you, Terry. Terry just put a link in the chat to the Facebook chat. I'm putting it in the Zoom chat too.
Excellent. And they, it is an application process with this school, but transformational training in the practical application of functional medicine that culminates in an applied functional medicine certification. Now, there's a lot of schools out there that do this. And the big thing that distinguishes this school from any other is the way it teaches you how to apply what you're learning. So there are a lot of great schools out there, and I have friends who have attended lots of different schools, but what they found is that they got out of the school and said, this is great, but now how do I use it? They had no idea how to use it. So this school really teaches you through case study after case study how to apply it effectively. And I actually have friends and one of my employees who have gone to many different programs. Like one of my employees went to 5 functional medicine programs, and she has said that this one by far is the best. And it's less money than some of the other ones that she went to as well. So I'll explain the payment options, but basically it's 2-semester program. In the middle, there's a clinical skills intersemester that teaches you really how to effectively apply it. So if you're doing a group program, how do you do that? If you're doing this in a managed care setting, how do you do that? If you're doing an entrepreneurial model, which most of you will be doing, or the groups, you're going to get to learn how to do that effectively. So not the marketing piece of it, but the actual clinical skills piece is in there, how to do a group program. Once you get the people signed up, what do you do? So that's great too. But there's basically 2 semesters, and you get these anchoring essentials courses and deep dive clinical courses. So I'll explain that in a sec. So the anchoring essentials include Disease 101, which is basically an overview of all diseases, how to get to the root causes, figure out what's going upstream. You get an introduction to mapping, which is an important part of how to puzzle piece and put things together. And you get puzzle piecing cases. Now, these are my favorite, the puzzle piecing cases. The teacher actually gives you a recorded session of her intake with a previous client that she worked with. So you get to listen to the questions she asks. What does she do in a session? How does she, what did she do to figure this out with this person. And then she does a 2-hour webinar after each case on what she did for that client, how she got them better, what labs did she get, what did she see in those labs, what supplements did she recommend, what lifestyle interventions did she recommend, and you get to see how she got them better. And when I saw this puzzle piecing case, that's what changed my entire practice. When I saw like, oh, this is how you do it. This is how you're effective at it. And honestly, it was life-changing for me watching these. And you get a whole bunch of these puzzle piecing cases throughout your tenure. And then you also learn nutrients and supplements. So Tracy actually teaches brand names and dosages and what to use and what's contraindicated. And no one supplement company gets everything right. I'm telling you this right off the bat. They're good. Some of them are good for some things, but not good for others. So she really tells you different options of what she recommends, and they're available worldwide, which is great too. And then sorry, go ahead.
I'm going to interrupt you. Sorry. This is what I do.
Please do.
But I think this might be a good time to address this question. Tabitha's asking, what nutrition school did you go to? Or does this, I'm interjecting, does this take the place of a nutrition school? And what is functional nutrition? Was it functional nutrition based? What percentage of your functional medicine practice incorporates nutrition? So you're talking about supplements and dosages and things like that. But if people are looking for how to change their diet, there's another question about nutritionally changing their diet. Do you give them recipes, or what's the best way to give them recipes and make those changes too? So you've got nutrition.
This is an excellent question. So yeah. I actually, I went to a school that was more of a health coaching school. It's called the Institute of Integrative Nutrition. And honestly, for you all, it would be like going back to kindergarten. I would not recommend it. I hate to say that because like a lot of people like it. If you're not an acupuncturist and you haven't done anything before and you're thinking of getting into this field, it's a great option. For you all, you're way beyond it. You're going to be bored. It's like eat more vegetables, get more sleep, drink more water, like very basic nutrition and lifestyle advice, which is critical. It's important, but you already know most of it. I mean, I felt like I could have taught some of those classes, honestly, because I was sort of like, I read a lot on my own and did a lot of my own before going, podcast junkie a bit. But anyway, so SAFM, the school that I'm talking to you about, they teach you nutrition. It's like they teach you nutrition, supplements, everything. And it's all woven throughout the entire curriculum. Okay. So you're going to get a deep, deep dive into nutrition. In fact, this slideshow is a little older because they changed the name of the course to nutrition. They added more nutrition to the program. And I feel like really, really confident in my recommendations. In fact, I really, sometimes when they go to a registered dietitian, I hear what they're been told to do. I'm kind of shocked. Some of them, not all of them. I don't want to bash all of them, but some of the information they're giving is old. But this definitely covers that, and so much more, and really root cause resolution. So just to go back, the lab work is an essential part of how I help people. So before I even meet with them, I'll get their last 2 years of lab work. And oftentimes I don't need to get any more lab work. And I know functional medicine has a bit of a bad rap of ordering thousands of dollars of lab work, and that's just not necessary. You're going to learn the functional lab work, and if you need it, you get it, but you're going to really learn how to work with existing lab work and just maybe 1 or 2 other markers if you need to get it, or you may not have to. It's amazing what you're going to learn without having to get a lot of fancy lab work. And then there's even a mind-body course, which I think a lot of you will really appreciate as well. Why this won't give me the next slide. Hold on. There it goes. And then level 2 has level 2 levels of all those same courses. But you also get these deep dive courses on the right. If you see disease begins in the gut 101, HPA-TG axis, adrenal thyroid foundations, reversing metabolic dysfunction. I actually help people reverse type 2 diabetes in an average of 3 months, full reversal. If they're insulin dependent, it sometimes takes longer, but this course is phenomenal, and it's great for any kind of metabolic disease. And then there's immune function, loss of tolerance and hypervigilance. This is in the second semester where you get more into autoimmune diseases, asthma, allergies, all those things. You get mitochondrial function and cellular metabolism. This is great for people that come to you for weight loss and people that come to you for all kinds of mitochondrial dysfunction issues, toxicity, detoxification, and heavy metals. This is so prevalent everywhere. Mold toxicity, heavy metal toxicity. I mean, it's a big part of why people have problems with their disease. So you get the gut, you get all these classes. There are additional deep dive courses you can get too, like on ADHD and cancer and gosh, there's a dozen of them, like bone health, all kinds of different courses that you can take additionally.
So before you move on, Jodi, can you just go back to that slide for a second? Sure. So when you saw that first vitiligo patient, were you in you said you were in the first semester?
Right. And actually I know the autoimmune one is in the second semester. When I was going through the program, they didn't have it delineated like that. Okay. But I will say there's plenty of resources in the school, even if you haven't taken that course yet. Oops, sorry. That you will learn what to do for those people, a lot of foundational stuff, which a lot of it's foundational. 70% of it is foundational work. So you're going to learn all that in the first semester anyway. And then getting more of a deep dive into it goes into the second semester. But
I'd be such a scaredy cat. I'd be such a scaredy cat to offer somebody help while I'm still learning. So I love that you were able to have such an incredible impact on somebody while you were still learning. I don't know how you had the confidence to be able to do that, but clearly you're getting the information you need to make good decisions.
Definitely. In fact, I remember the first time that woman, Beth, who you said had such a huge transformation in her looks, the one, you know, who got rid of her fibromyalgia and migraines and all that. She came to me and she had already been to 2 functional medicine doctors. And I about freaked out when I said I'd take her as a client, because I was thinking, who am I? You know, I didn't even have any medical background. It was all, you know, nutrition based and things like that. And if I can help her, you all with your knowledge are going to be able to help people on a huge level. I mean, it was amazing to me that I was able to help her. And it's not because I'm smarter than that functional doctor. I'm definitely not. But honestly, I'm better trained. And a lot of people go through a functional medicine program. They'll go through like a 5-day program, an intensive program, and it's awesome. It's like, oh, you get these great speakers. This is incredible. But you get out and it's like, how do you use it? And then you buy the whole program. And then you still get out and you still don't know how to use it because they don't have the case studies. So remember those puzzle piecing cases I told you about? That's huge. But I also want to show you, let me show you the other, if I could, the other part of the curriculum that has made a huge difference for me. Oops. So the clinical skills intersemester, I sort of talked about where they teach you how to use it effectively in your practice. You get to learn how to do that one-on-one session, like how often do you meet, all those things that you are asking me are covered in this, and then managed care, short visits, also group program visits. But this is Tracy Harrison. She's the founder and lead educator of SAFM, brilliant woman, 3 degrees from MIT, and just amazing, warm, loving person who really is on a mission to change medicine and make this accessible to all. But anyway, we have these open coaching calls that she does. So you or one of your classmates can actually present a case that you're working on, a patient case. And she will go through, everybody's on live. And if you can't attend live, you can always get the recording, by the way. But she'll say to you, okay, based on what, you know, Mary has said, here's all the symptoms. What do you think is going on? And she'll wait and everybody types in what she thinks. It's like, it's a safe space to learn. Just guess if you have to guess, you know, so people are typing in the connections they see and what they think is going on. And then she will tell you what she recommends and what she sees in the lab work and what she would do for this patient case. And so you learn through case study after case study after case study how to do this work. And there's a coaching call in the beginning, you get beginner ones, and then you're also intermingled with the advanced ones. So if you've had some functional training, that's great, because you'll be right diving in the pool with the advanced work too. And if you only pick up and can only understand, you know, 50% of it, that's okay, because through repetition, you're going to get it. Don't worry. So she likes to have you go in for the more complex cases right in the beginning too. But anyway, there's also this treasure chest. Remember I told you there's tons of resources? Well, this is literally a database of over 1,000 questions. So I'll use an example. I had someone that came to me the other day with HS, And I'm like, oh my gosh, I am a specialist in skin and I don't even know how to do HS. I've never used it. I've never done it before. And I looked up in the treasure chest, and sure enough, there was a whole post of all the things you should do for that condition. And I've done that for lichen sclerosis. I mean, anything that comes to me, there's case study after case study in there of question and answer. So you'll get the answers that you want. And if you can't get it there, there's a forum. And the forum is like a souped up Facebook group for students only. You get access about 4 months in, and you can ask questions and present your case right on there and get answers. She has about half a dozen graduates answering questions on there. So I always feel so supported in there that I feel like there's nothing I can't do, because you can ask questions and get answers almost immediately on it. So it's great. There's also small live group collaborations. So you meet once or twice a month with a group that is led by a graduate, and you can ask questions in there. You have probably be other acupuncturists in your group that you could talk to and hang out with and, get a study buddy with. There's that practitioner forum I was telling you about, the Facebook group. And then there's a student connect tool, so you can connect with the other students and collaborate with them as well. But there are several ways to learn. You get the webinars, the audio, the video, you get the slide deck. You can actually present the slides in your own patient cases if you want, or in your group programs, you can use them. There's written transcripts for people who like to read instead of listening to a webinar. There's tons of links to really curated research articles. So she'll literally sift through hundreds of research studies before she presents a class. And she takes the ones that are the most poignant and the best studies. So you can back up what you're saying for your clients and patients. You can actually give them the links. So it's great. There's tons of articles and resources. This intercourse Q&A and done for you patient handouts. I use the handouts all the time. You can put your own brand on it, but there's probably hundreds of handouts that you can use. So if somebody needs to go gluten-free, you've got a handout to give them. So you don't have to, do it all yourself. It's amazing. And tons of student support. So there's student experience coaches. They're almost like your guidance counselor. They're amazing people that can help you get through. There's customer support. There's custom consults. I'm actually a teaching consultant. So if you have a patient case that you're really stuck on and you want to sit down for 50 minutes and pick my brain on it, you can schedule an appointment with me or any of the teaching consultants in the school. Most of them are MDs or naturopathic doctors. They're different levels of PhDs in biology. They're wonderful. Even if you need business help, like I'm not sure how to set up my structure of my business, you can set up an hour appointment with me. And it costs a little bit extra for this. It's like $130 a session, but it's totally worth it. Like if you were to meet with me outside the school, it'd be a few $100s for business consulting, because it's not really what I want to do, but I'll do it if somebody really wants it. So
there are a lot of questions that are popping up, Jodi, about,
yeah, sure.
and I don't know if you can specifically answer them, about acupuncturists and, what kind of, what are the legal issues with acupuncturists doing functional medicine and telemedicine? Like those are two different things, right?
Great question. So here's the thing. And I get this question a lot from nurse practitioners. There's a lot of nurse practitioners in the school, and they're just like, I can't, how do I do this? Aren't I held to this? So from what I understand, and I'm not a lawyer, but, and you can check with your state. I mean, the issue is there's really not a lot of oversight on this kind of thing. But if you do it in the capacity of a health coach or a health consultant, and you make that clear on your information that you're doing this, that your background's as acupuncturist, but you're doing this as a coach or as a consultant, then you can do this work, from what I understand. So I have actually on my own staff, because I'm so busy now with my own practice, I've hired other graduates of the school. One's a nurse practitioner and there are 2 MDs on my staff. Actually, there's technically 2 NPs on my staff also. So these people are all doing this as a health consultant. They've kind of put their degree aside and said, and they keep their license, but they're just like, they're like, I don't even know why I'm keeping it, because first of all, they're making more money doing this work. Second of all, they're getting better results for their patients, like way better. And they love the work. It's fulfilling. You can set your own hours if you're doing it more as an entrepreneur. So, and some acupuncturists have closed their physical office and just went off to do this one-on-one online, or you can keep your office and just turn it into a functional medicine office. Functional medicine is hot right now. People are looking for this.
It's really hot. I mean, I contacted Jodi personally because I have a patient who's looking for a functional medicine practitioner in Vancouver, Washington. And it's just like really hard to find someone who has the degree of knowledge, really, and good reputation that I can refer to. And so the fact that you have a virtual practice makes it a lot easier for me to be able to refer to you, but also as a practitioner, I can see where that would be highly, highly valuable. And I would also just say, Jodi's not a lawyer, I'm not a lawyer, but I would definitely consult with a lawyer to differentiate, and maybe even differentiate your LLC into an online education versus your clinical practice. And that gives you a lot more protection. But I mean, that's something that you really do have to look into. But I want to also go back to the blood work, the lab work stuff, because the perception is that there are certain states that just do, well, there are certain states that do not allow acupuncturists to prescribe lab work, right? But you're saying there's a different route to this. And if you could just explain that a little bit so that we understand it.
Absolutely. And so you're not ordering the lab work. Technically, you're facilitating getting the lab work.
Okay.
So your patients can go online to mymedlab.com, or there's a whole bunch of all labs or anytime labs or whatever it is called. They can just order their own. I mean, they really literally can do that. So lab work is becoming much more accessible, which is great. The problem is interpreting it right is the problem. And that's where you come in. But I like Evexia Diagnostics. And again, Terry, if you could put the link in the comments, that would be great. And in the Facebook group, I'll have her put it in there, my link there. So you'll get $250 off with my coupon if you're interested in it. But you could do Evexia, but and SAFM grads automatically get the same discount for Evexia. They get the $200 removed. And so what you're doing is you're placing the order, but a physician is the one who's actually ordering the labs, not you. So it's off you. They're just getting it to you and facilitating it.
And we don't know this physician. This is just a physician that's part of...
Works for Evexia.
Okay.
And they're signing off on the order.
Okay.
And there's others like Rupa Labs does the same. Rupa's another one that'll do that. But I think you have to be a prescriber, I think, to use Rupa. I don't think it's available for... it depends on your state you're in. So if you're able to prescribe, I guess, then you can do Rupa. But I would just do Evexia because it's same kind of thing, same basic thing. The waiving the $250 startup fee, and it's just like, it's a great option.
And this is all stuff that's taught through the program.
Yeah, and in the huddle groups, they call them the tribe mastermind groups, where you can ask all these questions to people because they're led by graduates like me. So if you have like, I don't know what to do, how to do this, it's like, it's just like an informal talk. And you're like, I have a patient who has this, and this, I'm concerned about this. What do you think? Or I'm thinking of starting a brick and mortar practice for just functional medicine. What do you think? Or I want to go online. What do you think? So you get the collaboration of the group and learn from your peers, and it's great. It does not feel like an online program. Everybody says that. All the other programs they've done have been like an online. This is like a family. It is just the warmest, most amazing group. They actually have retreats once or twice a year where you can go. Like there's one in Austin, Texas this past spring. They've some in Connecticut. They're all over the place where you can just go and meet. And there's so much fun. And it's a learning opportunity. And so I've met some of my best friends, honestly, through this community. It's been amazing. I really have really good friends all over the world now with this.
There's a really good question here. Somebody says, please explain why the school's website says it's a 2-semester course, but takes 2 to 5 years to complete.
Yeah, that is a great question. And it's like, I even talked to Tracy. I'm like, you sure you still want to call this a semester? Because it's like a semester, it really implies 4 or 5 months, not 2 years. But no, great question. So it is a 2-year program at minimum. And I know people are saying, oh my God, that is a huge commitment. It goes by fast. You're going to be 2 years from now, it will have gone by quickly. And it's like, whether or not you have done this or let things go, you're still going to be there 2 years from now. And I will say you can start using it right away. My clients never even knew when I graduated. They just they knew they were getting results, but this can take more, let's say you start doing this and your practice gets busier and busier, you may take longer than 2 years to complete. I mean, some people take up to 5 years to complete the program, and that's okay too. It's self-paced. So those core classes are already recorded, so you can listen to them at your own convenience. The live classes are live, but if you can't attend a live session, you just go ahead and listen to the recording. So you can pace it any way you want, and you meet with that, the student experience coach can help you pace it. So I would recommend putting study blocks in your schedule. So I'm going to study Tuesdays and Thursdays from 3 p.m. to 6 p.m. and you put them in your schedule so that you're there and you're doing the work, and you just don't let it slide because it's an online program. But the student experience coach will nudge you along, and the live classes you're going to want to keep up. And personally, I couldn't wait to listen to the next webinar. I was like on fire. I was listening to like, oh my God, everything I was listening to was just like so inspiring and so amazing. And in fact, one of the things that we're offering, and I think, correct me if I'm wrong, Terry, I know Terry's my assistant listening. She's my practice manager, and she, I think we're giving away the headaches course for free. So anyone listening here today is going to get a copy of that. And it's 90-minute course. You'll get a really good feel for her teaching style. Don't just apply without taking this class first, because if you take the class and you don't love it for any reason, you don't want to apply to the school, because she's pretty much the sole educator for the school. You're going to be listening to her for 2.5 years. I think you're going to love it. But I was just like, everything she said just made so much sense to me. It's laid out in such a logical way that I was on fire with the learning. I couldn't wait to listen. I actually finished it really quickly because I couldn't wait to listen to the next.
Yeah, we will include that link to that course will go out with the replay link. So everybody who registered will get that link. And I think Terry's going to put it in the Facebook chat. Let me ask you a question, Jodi. Is functional medicine, like, is there a standardized certification for functional medicine practitioners? Like, for acupuncturists, we have the National Certification Commission. Right. Is there something similar to that for functional medicine?
I have to say, it's sort of the wild, wild west out there right now. There is no standard for functional medicine. In fact, there is no, if anyone tells you they're board certified in functional medicine, they're lying, because there is no board certification for functional medicine. But it's, so there's just learning, and you're already, SAFM, you have to have a degree or certification in a medical or health field. So I wouldn't have qualified if I hadn't gone to that first school, but you all qualify as acupuncturists, and you're going to be in there with 80% of the students are medical professionals. So really, really good. You'll be in good company. There's a lot of doctors, nurse practitioners, PAs, even OTs and PTs and massage therapists. I mean, there's all kinds of modalities in there, which is amazing. And a lot of nutrition professionals, but 80% are medical practitioners. So you'll be in very good company. And so there is no standard certification, but I will show you, actually, that brings me to my next thing here, is that you will get AFMC certified. And this is, I know there's another school that says they're the gold standard. I really feel this is the gold standard. It's not an easy certification, but once you get this certification, first of all, you get into the database of AFMC practitioners. And I've actually got new clients that way, because people look, they Google it and they find this, and then they find me through that service, which is great. And it is ACCME accredited. And I think there's other accrediting agencies as well, so you can get continuing education credits. I'm not really sure about acupuncture continuing education credits, but I don't know if you're eligible for converting CME credits to anything. But anyway,
yeah.
Can you get CMEs?
Yes.
Oh, wonderful.
I mean, okay. There's some leeway, so you kind of have to check it, but I think there's a certain amount that we can get that aren't specific to acupuncture.
Okay, so it gives you 50 CMEs per semester, so 100 CME credits. Yeah, pretty good. Huh? And actually, for the price, it's really good. And it's not like your average CMEs. You're really going to learn a skill set that will be life-changing. And I will say it's life-changing for me and my family. Like everybody, I can't believe how well it's helped. I wish I'd known this earlier, because my kids wouldn't have got ear infections. They wouldn't have got sick, all these things I would have done differently in raising them. But anyway, this is the scientific review board or medical review board. And you can see there's some big names on here. I don't know if you've heard of Dr. Frank Littman. Dr. Robin Berzin is head of Parsley Health. Jeff Glad is pretty big. Some of these they're like on Dr. Oz all the time, but it's amazing. They're overseeing your certification. And so there's a few tracks you can do, like full-time, which is anywhere from 1.5 to 2 years. It requires about 25 to 30 hours study a week. So if you want to buzz through it in 1.5 years, you can. There's more of a standard. This is what most people do, is like from 2.25 to 2.75 years. And it's 10 to 15 hours a week. That's sort of more what I did. And then there's extended, if you want to take up to 5 years. Like I said, you could do like 8 hours a week and just take your time learning it. And you get 5 years to complete the full program. After you're done, you get continuing access to a lot of the things as well. But there's a lot of scientific rigor. She goes through tons of studies. I swear she eats research papers for breakfast. She's so brilliant. But you're going to learn so much devil in the detail. And it's a system. She's a system engineer by background as well as a chemist. So really, she takes a systems-based engineer thinking that allows you to really customize an approach for your unique patients. That rather than relying on protocols, which people are asking me, what about other programs? There's a program I know a lot of people go to, and they just teach you protocols. Well, that's great, but what if it doesn't work? Then what do you do? And there's like no answer. Like not everybody's unique, and you really have to understand the complexity of it in order to get better results for everybody that comes to you, not just, a subset of people that come to you. But the thing I like best is this rapid relief and root cause resolution. So with every single client that comes to me, I try to find one area where I can give them rapid relief. And this is really one of the keys to the success of my practice, because they'll come to me with a whole bunch of symptoms, but one of them's acid reflux. And I know that's an easy fix. So I'm going to work on that first while I'm ordering, facilitating getting lab work or whatever. They wind up reversing the acid reflux. They come back to me 2.5 weeks, 3 weeks later to one of my practitioners, like, oh my gosh, my acid reflux is gone. I cannot believe it. I suffered for so many years. I'm talking to my doctor about weaning off the prednisone, Prilosec, like or a Meprazole. They're already like excited and turned on by this whole thing. And then they're like, what else should I do? So they never ghost me. They always come back for more. And then there's real life case studies and repetition designed to build skill and confidence for working with the most complex patients and clients. So qualifications, there are prereqs. You guys have to have a license or certification in a health field, which you're set, check. You have to have a familiarity with functional medicine. That could be just taking that headaches course. And if it turns you on, go for it. But you have to have some kind of familiarity with it. You have to have an active practice. So those of you who are retired or not working actively, you could still apply and just say you want to get into this work, but they'll probably put your application and have someone contact you just to make sure that this is a good fit for you. So, but you have to have worked with like at least 8 patients in the last year. So if you're on maternity leave, you're probably okay because you worked with 8 patients within the past year. Okay, you have to have experience with SAFM content. Again, take the headaches course. It's great experience with the content of the school, just to make sure it's a good fit for you. And also basic education in anatomy and physiology. They don't want anybody just out of school that doesn't have that kind of background, that might somehow maybe they're a massage therapist and they don't have a lot of anatomy and physiology. They should as a massage therapist, but anyway, that's what they're looking for. And these are the prices for the program. So as I mentioned, August 10th, 11:59 p.m. Eastern time, these prices are good. So it's usually $12,297. By the way, I know of another program that's $40,000 and nowhere near as good. So this is the paid in full price. You can do it over 2 payments with no interest. 6 payments is a little bit, and then it goes all the way to 24 months. Now, even if you pay the interest, or you could put this on a 0 interest credit card, the paid in full price, and then pay back your credit card each month, it'll be like 400 something a month. But even if you do the 24 months, if you take on 1 or 2 patients that are doing this program, it'll pay for the whole thing. So you take on 1 or 2 patients as you're learning this, it'll pay for the whole program, but it'll up level you so much. You'll be able to raise rates. You'll get more patients. You're going to get, even if you only use it while you're performing the acupuncture, then you will still get more people coming to you if you haven't filled your practice yet, because they're going to say, oh my gosh, this person's a genius. I want to work with them. So anyway, so that's how it works. Any more questions, Lisa?
There are a whole bunch, but I want to ask a question about this here, because The idea of like me, I'm putting myself in the position of somebody doing this, which I'm headed towards retirement, so I don't really want to do this, but you're tempting me. But I don't want to spend more time with people, and it seems like very time, that you have to spend a lot of time. And you mentioned doing group programs. So can you just take a minute and explain how you would do a group program when you're seeing clients or patients? You're doing the one-on-one, right? You're doing the one-on-one intake. How does that then get into a group situation where you can kind of maximize your time a little bit better?
So let me explain a couple things. So first of all, with the time it takes, yes, it takes more time. There is definitely more prep work, especially in the beginning, because you want to do really well for the first patients that are coming to you for this. And once you do, it took me more time in the beginning because I was getting used to like, how do you map somebody out? What do you do? I'll show you an example of like, I actually map out every client. This is an example of a map that you could see. Like I put all this detail. Nobody does this like as much as I do. This is a really intense map. Not all of them are that bad, but I actually take the time to do this because it helps me to figure out what I'm going to do next. And it's like a blueprint for it. So you're going to learn how to do all this. But even if you don't do the mapping and you're just using it in your practice, you can do it that way. As far as groups go, I have a couple ways that I'm doing groups. One, that Vanishing Vitiligo requires some one-on-one appointments because we have to customize for those people. So for that kind of program, I actually have them meet with a practitioner 5 times throughout the course of the year. So we cover all the basics. They have 18 sessions with me on, me and my partner we do this program together. Over the year, they do a full year and they meet with us twice a month in a live group setting, and then they can get the replay if they don't want it. So that's one way of doing it. It's kind of complex. It evolved to this because, vitiligo is not easy. It's a really complex issue. Now, if I was going to do a program like on migraines, I could probably do a 6-week, or acid reflux. I could probably do a 6 to 10 week program. And just like, I don't need to meet with them one-on-one. I can just do the program because I know what I'm doing. I probably, should have gotten to something easier like that. But I'm doing an anti-aging program. Actually, my birthday was yesterday. I just turned 58. And what I find is, thank you. What I found is that in working with people on their various health issues, they usually look about 10 years younger by the time I'm done with them. And a lot of people are surprised to hear that I'm 58. And it's like, I think my autoimmune disease saved me because I have incorporated this lifestyle, and it helps me to, I haven't had any cosmetic surgery or any cosmetic procedures at all. I'm sort of against the Botox thing. It's like, let's inject poison into your face. Yeah, good idea. But anyway, so I'm doing a program for an anti-aging program that's going to be a 9-week program, and I'm trying to scale that big. And I know you talked about the scaling, but that's just another way to do it. There's no wrong way to do it. The options are, I keep thinking of all these new things we could do. Let's do the course on this. Let's do an reversing diabetes. Let's do this. And there's just, the options are endless.
And the nice thing is because of 2020, patients now know how to go online and take courses. Like, that's not a big deal. There's not a lot of friction to get them online to do educational courses anymore. So that's kind of a nice win-win. Do you mind if I read off to you some of these questions?
Yeah, go for it.
A whole bunch in here.
Rapid fire.
Let's see. Let me go. I'm going to start down here. So, are there final exams?
Yes, great question. So there are self-tests at the end of those core programs and the deep dive clinical courses that don't count for anything, but they just sort of make sure you're on track if you can answer them. So they're just quizzes at the end. And then there are, at the end of each semester, semester in quotes, you get an exam. And once you pass that exam, you go on to the next semester. Now, the exam, there's no fees or anything for it. You just go ahead and register for it and you take the exam. And then if you don't pass for any reason, you get retakes. So you get a retry. And if you don't pass again, you could pay for a retake after that. So there's like, I think, a free retake, and then you can go on. but most of the people pass. And I think the people that don't pass are sometimes the people that aren't as educated as you guys. I hate to say, but people that maybe are a health coach that are getting into this, that are a little over their head, but you guys have so much more knowledge, and I think you'll do fine. And then at the end, there is a case study. So they call it level 3. There's no preparation for it, but there's a case. Tracy presents a case study. You map it out, and then you answer questions about the case study. What interconnections did you see between the symptoms and the labs and this and that? And you just put it out on like 250 words or less on each section. And it's not timed, the case study, which is great. So, but it's all online. You don't have to go to any testing center. It's honor system. See, you're not supposed to talk about the exams or anything that's in them. So I can't really get into details about it, but I just want to say, I think you'll all do fine with that. And even if you don't, you get a retake. So it's not a problem.
Okay, thank you. And then there's a question about, does the program focus at all on treating SIBO?
Yes.
It's a big
In
one.
fact,
Yeah.
I have worked with a lot of SIBO cases, and
So just for people who don't know, small intestine bowel overgrowth.
small intestinal bacterial overgrowth. Yeah.
Okay.
So I'll just share my screen one more time really quickly to inspire you all with SIBO. And I will say SIBO is not an easy one for a lot of people. I have had tremendous success with SIBO. And this woman, by the way, had infertility. And at age 46, she's able to have a healthy baby boy working with us. So that's another, I mean, if you just did fertility, that would be incredible. This one had all kinds of health issues too. Let me see if I can find a couple SIBOs. This woman had terrible SIBO. You can see, she said, coming to me, it was like an extreme college course in self-care nutrition. I think much differently about the food I eat, etc. And she knows what to do if her SIBO returns. I'm incredibly knowledgeable, blah, blah, blah. She actually referred a friend of hers to me. This one on the left, look at the incredible bloating she had. And we were able to bring that way down. And in fact, this woman did so well. She was with me on, she was telling me about her son that was a mess with his symptoms. And he had such bad asthma. He was on 3 medications for his asthma. And I told her, hello, I can help him. She said, oh, I didn't know you did asthma too. We were able to reverse his asthma. He's off all his medications. He's playing hockey again, which he wasn't able to do. I mean, the kid's like a new kid. And also he had ADHD symptoms that are gone now too. So, I mean, incredible what's possible.
All right. So how about working with unexplained infertility, endometriosis, PCOS? Will this training address that?
Yes. As a matter of fact, I showed you the fertility one, the woman that was 46 that just had a baby. We work with infertility. In fact, it's kind of bad because we've had a lot of clients that wind up getting pregnant while working with us, and we don't feel they're ready yet. We want them to take care of some other health issues first before they have a baby. But yes, PCOS, I've supported probably about 20 clients with PCOS. It is completely reversible. And endometriosis, all these things are reversible. So we work with a lot of hormonal issues, hot flashes, estrogen dominance. I had one woman who was lactating so much, her prolactin levels were high, and she hadn't had a baby in 5 years and she's still lactating. It's like, oh my gosh. Okay. So we were able to reverse that. I mean, it's so many things that we've been able to help with hormones, and it's all reversible. And you'll learn Dutch testing and blood hormone labs as well in depth, and what to do with symptoms and how. And I always test and don't guess when it comes to hormones, because you'll be surprised how wrong you can be when you try to guess and you give the wrong intervention. It's like that can make things worse. But hot flashes are one of the things that helped me too. Going through the school, I was not only able to get to all the root causes of my urticaria and reverse them. So I'm in full remission now for 6 years, which has been amazing. But I also, I don't get hot flashes anymore. I know I'm 58 now. I just finished menopause. I mean, it's weird I went this long, and I didn't have any hot flashes. I mean, I had so many things that were beneficial, and I think more clearly now than I did in my 20s. My ADD symptoms are much less. I mean, almost gone, really. I still have sort of the characteristics of a laser focused person, but I'm much more focused and better than I've ever been before. So it's just what's possible.
All right. So I'm going to ask you a few more. So one of the questions is, did the forums last past graduation? So the forums that are led by graduates, do they still have access to the forums after graduation?
Yeah, great question. So after graduation, first of all, you have access for 5 years I think it's 3 to 5 years to the forum. It depends how you do how you spread out your thing, but you have access for a fair amount of time to the forum. And then after you graduate, well, if you want to just continue and you don't get the certification, it's $99 a month. That gives you access to the forum, all your classes, all the support, access to the teaching consultants, access to everything. And the classes every month. She continues to do open coaching call every month. So you get that case presentation every month. And I continuously do these because it helps me. I learn every time. But once you graduate, it drops down to $39 a month. So once you get the certification, it drops. And then you have to stay certified. Every 3 years, you do an exam. Now, I just got recertified. And what happens is once you get recertified, it drops down to zero. You get lifetime access to the forum, the classes, everything, the community, wow, free for life, which I love because a lot of schools will nickel and dime you and charge you like $800 a year for access to continuing education. And it's like over the years, that really adds up, or even $400 a year. It adds up where you're going to get, right now I'm on lifetime. As long as I stay certified and take that exam every 3 years, I get lifetime access of everything for free.
Great. There's a question on Facebook from Lynn. How much does a coaching background play into your results getting behavior change? So that's a good question. Like,
yeah,
if you came into this as a coach, so like, is that necessary? Is that or do we get, as part of the program, some of that coaching to help people change their behaviors?
Yeah, great question. So for me, I was actually struggling as a coach, and they didn't have that 8 client minimum when I was going through the program. I wouldn't have even gotten in, honestly, because I've only worked with like maybe 3 clients, and I was struggling with it, honestly. I don't think I learned that much in the coaching program that that gave me that much of an edge. What did give me the edge was the case studies, and you learn through the case studies, like, okay, this person's going to be overwhelmed by this information, and you need to do it slowly. And you learn coaching skills, and there's also classes, like bonus classes on coaching in there. So how to get the best results with psychology, I forget the name of the classes, but there are a ton of bonus material in the school that teaches you the coaching skills that you'll need. And it comes along. You get better as you go. Obviously, I look back at some of my initial clients and I cringe at how I handled it, but I still got them results. Right. But I'm like, oh, that was not pretty. But you get better as you're going. Just like, as like your first patient, you probably didn't do as good as you're doing now. But yeah, I mean, you'll learn through the case studies, like, you don't want to do all these things at once because it's too much. And that's the problem with functional medicine. I actually brought my husband to a functional practitioner a while back, and she gave like 50 recommendations, and it was like way too much. And he's just like, screw it. I can't do this. It's too much. Yeah. So you never want to do that much. And we talk about this in the cases. We talk about it case study after case study. We talk about it in the huddle groups. You're going to learn through osmosis how to do this work and how to do it effectively.
I do like that the name of the school, and it's italicized, the School of Applied Functional Medicine. Like that, to me, you're taking that part very seriously. Like, that's the whole point.
That is the point, and that there's a deliberate reason why it's called that. And Tracy went to IFM. Actually, I hate to drop names. That she thought the education was great, but she didn't know how to use it in her practice. She was really confused about it. And what's great is that she did tens of thousands of hours of research and figured this out kind of on her own. And now, maybe that she had a really crazy successful practice with a 6-month wait list. And then she had to cut it off at 6 months, but for many, many years. And now she's, for the past decade, the school's 11 years old now. Oh. And yeah. And she's just been teaching people how to use this in their practice. And every year she takes student feedback really seriously. And every year the curriculum's different. It gets better and better and better. And it is really excellent. Yeah. I mean, just excellent.
Well, I know we're just at an hour. Do you have a few more minutes to take a few more questions?
Yeah, no, I'm fine.
I know you're super busy. So Is it required to do an in-person physical assessment for some conditions, or can you solely do this through telehealth?
You can do it through telehealth. Now, I don't, I'm not qualified to do any physical exam or anything like that. I know some of my staff are for sure, but they're not using this in their practice anyway. But yeah, you can actually absolutely do this without physical exam. I like to do it over Zoom because I can actually see the person. Sometimes you see like the outer third of their eyebrows missing. Well, that's a good indication that it could be a thyroid issue, or their hair's thinning, and you see things, you see the changes happening. Sometimes I have clients take pictures. So if somebody has vitiligo, I'll say, listen, take some pictures so we have something to base it on so you can see the repigmentation happening, because sometimes they forget and they don't realize how much they've repigmented. So
And next question, are vitamins and supplements the main treatment interventions, or are there others? And then how is acupuncture integrated, if at all?
Oh, acupuncture is a big part of it, actually. And Tracy is a huge fan of acupuncture. And we sometimes work together in a multi-disciplined practices. I have friends who have gotten like, okay, as a massage therapist, as an acupuncture, is this and all that in their practice, and they open a place together. But yeah, I mean, acupuncture is important, I think, for a lot of conditions. And I recommend it to a lot of my clients. So it's great to incorporate it. And like I said, you can just do this. And as you're working with your patient who has chronic pain, talk to them about root cause resolution. Like acupuncture, I know provides you a lot of relief, but we've been here 3 years now, or 6 months now. And I want to show you ways that you can appreciably get a lot less pain and maybe get to the root cause where they may not need the acupuncture anymore. Maybe you'll lose a few clients, or maybe you'll have some maintenance clients, because I know some people just come for maintenance, and that's great too. And they'll probably want to just stay with you and do that, but you'll be busy enough that I like to turn people over and get them out. My goal is to make myself obsolete to them, because
Right.
I want to help more people. But yeah, you can make this a big part of your practice, have them come for the acupuncture frequently, and then you meet with them maybe twice a month or once a month, or whatever you want for the functional medicine piece. Supplements can be a huge part. It's nutrition, lifestyle, supplements, anything that's going to help that person. Everybody is unique. So you have to look, who is this person? What are they suffering with? What do I think is going to be the best intervention for them? So you can say, okay, my prescription for you is this kind of diet. This is what I'm recommending. I want you to come in for acupuncture treatments twice a week. I want you to blah, blah, blah. You give them what they do. And then right now I want to start you on this one supplement, but I'm probably going to layer some on later on, but I need to do this first. We need to heal your gut lining first before we do this, or we need to take care of the acid reflux or the H. pylori or whatever it is. You start them with something for rapid relief, and then you work up. And I know I have some supplements, some clients I've added a lot of supplements for, and some I've done very few. It depends for their tolerance too. Some people are like, I can't take so many supplements. And we talk about this in the group sessions, in the case studies. And it's like, this person says they'll do 5 supplements and that's it. So you have 5 chips. What are you going to recommend? I mean, this is a great case study thing. It's like, okay, we talk about this in the case studies. What would you recommend if you had 5, you could only pick 5, and we all write down, so it really depends on the person. Every single person's different. And you and I might both have the SAFM training, and we might do things a little differently, but we're both getting good results for the patient. That's the funny thing. It's like, it's not like a direct, this is the right way to do it. And I work with when I do the initial session now, and I hand the client off, I do it with the other practitioner in my practice, hand the client off to the practitioner, and then we meet frequently about the case and we collaborate on it, which is kind of fun too. But that's sort of advanced. I did not do that in the beginning. It was just me in the beginning. And I have a virtual assistant now. I have a scribe now. I mean, I'm really setting it up so that I'm just really cranking with the business and helping people on a massive scale, which I love. I love getting people in and getting results, and just getting success story after success story where people are just so happy with the results, and just, people that were just not able to do their work or be a good mom, or, why did you get into acupuncture in the first place? You want to help people.
Right,
And
right.
this is like, I would do this for free. I love doing this work. It is so gratifying. Like, it's just, I just love what I do. And I think you all will love it too. I really do.
All right, now it's time to talk a little bit about finances because someone's asking here. You mentioned charging more with functional medicine. What kind of range do you suggest for graduates in terms of pricing, individual versus group?
So great question. And so I started charging very little in the beginning, and I'm probably not a good example because I just wanted to get experience with it.
Oh, I think
Well,
you are a good example because I think that we also, feel like, oh, unworthy and not
right.
sure. We're not sure.
That
So please,
imposter syndrome. And
yeah, please let us
yeah,
know. Yeah, give us some
no.
numbers.
Yeah. So in the beginning, I used to do a free consultation, which I would not recommend doing, especially at your level. You're acupuncturist. You could charge people for sure, but charge them something for a consult. And even if you're working on your friends and family, charge them a little bit. You can donate the money to charity if you feel guilty after or something, but or to their favorite charity, but charge them something. So I would do free, and then I went up to $49. Then I went to $99. Then I went up and up and up. I'm at $797 for a consult with me now.
Wow.
So yeah. And I'm not saying you should start there.
No,
And
no,
a lot
yeah.
of my friends charge half as much and they're comfortable with that, and that's fine. And again, I offer for people that I really want to work with that can't afford it, I will give them a coupon code for some money off. Or you could have people go do 15 hours of community service, give them a coupon for free consults so that they're helping the community. And so there's
That's
different
great.
ways to do this, but that's the way I did it. And it works well for me. And so, and I have a lot of people coming to me, so I don't have any problem with charging that much and then offering a sliding scale for people who really need it that I want to work with.
Yeah.
And then the people that can't do that can do the groups because the groups are less money. And then I do a package depending on what they do, but it comes out to, I mean, I'm really honestly making over $500 a session after that are 1 hour sessions. Some of them, it depends what package they buy, but like I'm selling like a $5,000, $5,500, $5,600 package or a $9,000 package that includes the lab work. So I'm doing much more than I ever even imagined, but I can do like a smaller, I can slide that for people that I really want to work with again, that make it more affordable for them
Well,
as well.
I imagine if people are getting over SIBO and autoimmune diseases and diabetes, that they're grateful regardless of what it is that you're charging. So
Yeah, well, that's the thing. And I think sometimes a person who has to give up their vacation to prioritize their health will get better results than a person that this is not much money for, and they'll just pay it and not worry about it. People that are really suffering, they'll come to me and they'll get relief and they're loving it and they're always happy they did it. And like I said, I get all my business word of mouth, I don't do advertising. I do post success stories with their permission on Facebook. So that will bring me some people, for sure.
Jodi, when does the September cohort begin? And why don't you remind us again? You said until August something, there's $1,000 off. Is that right?
Right. So the September, I think it starts the second or third week of September. Terry, if you could look that up and post it. I don't know if you can find that under programs or when the exact start date is, but it's sometime mid-September. It probably starts on a Monday, and they have a live kickoff meeting, which definitely go to that because she does an overview of everything. You start right in with your classes. It's a great learning management system that they have where once you're done with the class, it brings up the next one. So you can check off each thing as you're going. Lisa, what was the other part of that question?
Well, I added in, can you just remind us of the dates? Because you said that the midnight August something was the
August
last time
10th.
to get a
Yeah.
discount. But is that also the last time to register for the September cohort?
No, actually, the last day to register is August 31st. But if you're going
Okay.
to do it, and it's not register, it's apply. As long as you
Oh,
apply by August 10th, and then you have to wait to get your your answer back. And then they'll give you, if you wait till August 31st to apply, they'll give you an answer. Then you'll have a few days to decide if you definitely want to do it, that kind of thing. But yeah, I mean, if you're going to do it, I would apply by August 10th. It's a $50 application fee. It's worth it to just see if you get in, right? And then decide what you want to do. I think all of you will probably get in as long as you've taken the class and are familiar with Tracy and and everything seems good, you should get in. And then just go for it. I mean, like I said, don't be afraid to use it in your practice. Start using it. You'll get results. People will start coming to you. Put it up on your website, put it in your, material at every single patient you meet with, mention it to them, see if they're interested, see if they know anyone who might want help with this. And then for every person in the beginning, I would look up in the clinical treasure chest and get answers. So if I wasn't sure what to do, I would look it up and then like, oh, okay, this is what I do. And this is what I'm going to work on. And then use the resources of the school to help you.
Jodi, is this something that you need malpractice insurance for? Does the school advise you on that?
Well, do you guys get it malpractice insurance for your, yeah. Okay.
We
So you already
do
have malpractice.
for our licensing.
Right.
So that doesn't necessarily.
Yeah, you could check and see if this would count because it's functional medicine is just lifestyle interventions, right? I mean, you don't need a license to talk about supplements. And if you're feeling more comfortable saying it that, instead of saying take magnesium, you could say, well, Mary, you have, high blood pressure and you've got acid reflux and you've got muscle aches and you've got XYZ. These are all things that are signs of a deficiency or insufficiency in magnesium. And since you have constipation too, what I'm going to recommend is that, what my clients or my patients have had success with is taking 200 milligrams of magnesium citrate twice a day. And then the patient will say like, oh, that sounds great. I think I'm going to try that. And it's like, that's a great decision you've made. You're just advising them and educating them and they're making the decisions on it. But that said, with the licensing, like you have to check with, like I said, check with your malpractice insurance, see what's covered, see what isn't. I took out a liability policy. Terry, if you want to put the name of it, I don't remember the name of it on my thing. It's like a couple $100 a year. I got a basic liability policy. So it's not malpractice insurance, it's a liability policy. And it covers me for, anything. It's like a health coach liability. You don't have to have a health coach certification to call yourself a health coach. Anyone can call themselves a health coach. So don't worry about getting certified in that. I'm telling you, don't waste your money. It'll be like going back to kindergarten. It's just so, I'm serious. It is so basic. I was just like, I paid like $6,000 for a health coach certification. I was just so disappointed.
There's a question about the prices of the packages. It says 6 payments, and the question is that 6 months in a row, or 6 payments spread out over 24 months?
That's a great question. I'm pretty sure it's like it's in a row, 12 payments. There is an info session that's coming up. Terry, I don't know if you have my link handy. It's in my Google Drive for the info session, and you can ask those questions. So there's like an official info session of the school. I think it is consecutive payments. So if you can get a 0 interest credit card, you're better off even just, here it is. You're better off just paying in full if you can, and then paying your credit card back monthly at your own leisure. So just make sure you make the payments back monthly, because that way you don't pay the extra on it.
Yeah, I noticed that there is a info session that people can register for.
Yeah.
Okay. So
yeah,
that's one of the links.
We got the link for it. Lisa's, it should have 2002A at the end as well, Terry, on those. But yeah, no, it doesn't matter either way, I guess. But yeah, so do the info session, find out more about it. See if it's a good fit if you want. I mean, I pretty much went over a lot of the stuff that's in the info session, but I'm almost positive those are consecutive payments. So
okay.
So you could do it.
So there are a whole bunch of questions again about licensing in Washington State or different states, what we can do as acupuncture. So I'm just going to refer them back to watching the recording. We did cover some of that, but also it's really something that you have to look at for each state. And
let me just say this: everybody's afraid of this.
Yeah.
Functional medicine it's not illegal to do this in any state. Okay, so you can practice functional medicine. It's not the same as practicing Western medicine. I have no medical background, 0. I'm doing this in the capacity of a health educator or a health coach. You don't have to have a license or certification to be a health coach. So it's not illegal anywhere to do this work. You can incorporate it into your practice effectively and safely, and double check with a lawyer, but there's no laws on it. Trust me. I've had people like looking into this, like, oh, let me see. If you can do this work, and don't be afraid of it. And I know it's hard because it's like different territory, but honestly, your clients are out there buying crap supplements at at Walmart right now, right? They're
Amazon.
buying like Flintstones chewables and Centrum
Costco.
Silver, which has artificial colors that are giving them more autoimmune and pain symptoms. I mean, you're advising them on clinical grade supplements and things that are going to work for them. Like I actually bring in a nice side income just on the supplements. That's another thing you can get, like accounts with places like Full Script. I don't know if Terry can put the link in there too for that, where you can actually make a little bit of a residual income on that, or you can lower the price down and give your patients the base price on it so they can afford the supplements more. So I do a split, like I make a little money on the supplements, but I also give my clients a discount on it and they can order it. I don't have to inventory it. It just gets shipped to their home. Easy peasy.
A lot of us have accounts with Full Script and we're familiar with that. So that's nice.
Okay.
Sylvie says that the school website does not show the $1,000 off promotion. And I'm looking at that. The program cost shows here $12,297.
I actually just pulled this from the school. So let me, hold on just a sec. I'll show you where it is. So if you go to, I'm going to go to the school here, schoolafm.com. And when you're a student, you log in and you get a whole different display, dashboard, whatever, where all your classes are. But as far as you go to our program, and then you scroll down here and it shows you what the level 1, level 2, and the clinical skills intersemester, and then the exam there. But you could see the program components here, and that's the price. Now, then you see this view payment options here. So there's your $1,000 off, right? Then you hit view payment options and you get what I just had up on the screen. So it is like, see, it's regularly $12,297. That will be the price on August 11th.
I see. So in order to get the $1,000 off, the application has to be in by August 10th.
And you lock into these prices.
And then you lock into that. And
lock in just for this semester. Yeah.
Okay.
It tends to go up every year. So it will never be lower than it is right now. At least I don't think it will be anyway.
Okay, well, there's still more questions, Jodi, but I'm going to go ahead and let you go. I actually need to go too. I apologize to people who did not get their questions answered, but I will allow or invite Jodi to stay in our Facebook group for the next few days, if you don't mind popping in and just answering questions. Would that be okay with you?
Absolutely. I'll stay in. And if any of you want to ping me directly, it's Jodi Berwick Franklin. BURWICKH Berwick Franklin on Facebook. You can just message me through Messenger, and I'm happy to answer any questions. I can even get on the phone with you if you have any quick questions to ask. I'm happy to do it.
Wow,
I wish somebody had told me about this school years ago. First of all, I would have put my own autoimmune disease into remission. I would have been able to do a career of this, years ago. This is what my passion is, and I didn't know it was possible to do this without being a physician, really. And have so much success with it and putting all kinds of chronic diseases into remission. And I will say the biggest thing the school has given me is confidence. Like anybody who comes to me with anything, I'm like, even if I haven't even heard of the disease before, I say, I'm confident I can help you, because I know I have the resources. I know I can figure it out. And I tell people, listen, there's no guarantees that I can do things 100%, but if I can get you 80% better or 70% better, they're like, I'll take 10%. They're like, just get me, whatever. And I have people coming to me from all over the world now, literally saying to me, like, and I ask them, how'd you hear about me? And they're like, oh my gosh, my brother's chiropractor's daughter, I don't even know how they hear about me now, but it's because I have had success stories, and all my friends who've graduated the school have a similar. It's hard to find somebody who graduated and doesn't already have a busy practice, because I was trying to hire people that are already graduated. I couldn't find people that weren't already too busy with their own practice. So there will be no shortage of work. There's definitely a demand for this, and I think you all will love it. It's the most rewarding thing I've ever done professionally in my life by far.
Well, thank you so much, Jodi, for being a part of Acupuncture Business Academy and for letting us know what it is that you're doing and how we can also benefit. For everybody on the Zoom chat, you will get an automated email that gives you the link, but I'm also going to add Jodi, I'm going to add your ping me link if that's okay with you, if they want to contact you. So they'll get a little bit more information. And then everyone in the Facebook group, that information will also go in there too.
Awesome.
All right, Jodi, you have a great day. Thank you everyone
Lisa.
for attending.
Take care, everybody. Thanks
And,
for joining. Hope to
yeah.
see some of you in the school.
All right.
Take care.
Take care.
Bye-bye.
Thank you. Bye-bye.